My name is Julian Wynne, and it's my pleasure to be introducing the event and our professorial panel of speakers. A few notes before we start. First, you may have noticed that a recording of the webinar is being made. The recording will be made available to you in the very near future. Second, and many of you have already done this, thank you very much. Please mute your microphone and turn off your camera. This just enables a smoother viewing and listening experience for all those that join us. And last, as they occur to you, please add your questions into the chat box. We will address as many as possible after we've heard from our professors. And if you would like to say hello to the assembly and tell us from where you're joining us, please add that into the chat box too. And so to our speakers. Our professorial panel comprises Professor Joe Greenhouse and Associate Professor Ana Manzano from the University of Leeds, Professor Mike Coldwell from Sheffield Hallam University, and Professor Rod Schieff from the University of Plymouth. And I am joined by Dr. Katie Sheehan, also at Sheffield Hallam University. Good morning, all. We're honoured to have you here. And this is going to be our first presentation, which is coming from Professor Mike Coldwell. Professor Coldwell is Professor of Education and Head of the Centre for Development and Research in Education at Sheffield Institute of Education at Sheffield Hallam University. He's led over 40 evaluation and research studies for a range of clients and funders, including government departments, charitable trusts, and policy organisations. These have led to 70 reports, several hundred presentations, and well over 30 academic publications. His work has influenced the policy of organisations, including the Department of Education, the National Centre for Excellence in the Teaching of Mathematics, and the National College for Teaching and Leadership, and its two predecessors, as well as the Science Learning Centres Network. In addition to this work, Professor Coldwell provides evaluation strategy advice to the Shine Trust, an education charity helping disadvantaged children in the north of England to fulfil their true potential. He acts as external advisor to the Educational Endowment Fund on its evaluation work on behalf of the Department of Education. Professor Coldwell, good morning, and thank you for starting our webinar. Over to you, sir.
Thank you very much, Julian. Yes, it's really, I'm really pleased to be here. I'm just going to share my screen now. Julian, can you see that?
Yes, we can. That's fine. Thank you, Mike.
Great. Okay. So yeah, thanks again. It's really exciting for me to be here, and I'm really looking forward to hearing the other presentations as well. So I'm presenting on a paper which was published a couple of years ago now in the journal Evaluation, and this paper comes really out of my experience as an evaluator, and as I said at the start of the paper, really a sort of feeling of kind of, perhaps inadequacy is too strong a word, but a feeling of kind of lack of benefit from thinking about evaluation in lots and lots of evaluations that I've done over the years. The same kinds of what I'm going to call observed or observable factors, contextual factors, come up time and time again. You know, if you're in a school, most of my research is in schools. If the senior leadership isn't supportive, if people aren't motivated to get involved, chances are it's not going to be very successful. You know this before setting foot in the field, and there's not a huge amount you can learn from that. So I started to think, that was what made me start to think about context a little bit differently. I'm not going to talk a lot about what I mean by context, but the sort of, I've just put on the slide, you can see there just the classic kind of Pawson and others, the four I's, the social and cultural conditions within which programs and interventions occur. That's what I'm kind of thinking about. So I'm not referring, for example, I'm not exactly sure how you pronounce their name, but Rodge's paper, some of you might have known from a few years ago, talks about other types of context, for example, the political context within which you're working and the evaluation context, which might affect the methods that you use. It's the context within which the program occurs, and one of the things that I kind of worked out, and this partly happened in response to telling me to sharpen it up a bit anyway, response to some reviewer comments on the paper. So if the anonymous reviewers are present, thank you for that. Where I started to distinguish between these observed or observable contextual factors, the aspects of the context that empirically found to influence the program, from the underlying features of these factors. That was, and that's what I'm talking about today. The way those things are, the way they operate, their characteristics. That and I hope that would help me understand a little bit more about the evaluation. And the argument in the paper, and I'm going to build it here. I work within, I would say, theory-based evaluation broadly, that sort of frame. And I think my underlying philosophical perspective is aligned with realism. I don't really do kind of realist evaluation in its purest sense. So I'm prefacing this because I think this kind of model you may have problems with from a realist evaluation perspective. But this is a model that I use as sort of jumping off point for the paper. And it's what we call a path model. I've done a lot of work around teacher CPD, teacher professional development, and there are lots of these kinds of models kicking around in that field. And it's a sort of akin to a logic model, which I'm sure you will know much more about. And the idea is there's a simple kind of path type approach there, that if the professional development program has got a set of features that are described in that first box, then hopefully that will influence teachers' knowledge and skills, maybe their attitudes and beliefs. They'll then change what they do in the classroom, their instruction practices, and then hopefully students will learn more. Those double-headed arrows are to indicate that it's not quite as simple as that. So, for example, particularly thinking about changes in teachers' attitudes and beliefs, there's evidence that actually teachers need to see student learning improve before they will actually change their attitudes and beliefs, and therefore their instructional practices in the longer term. So it's not quite as simple. But what you can see there in the program is at the bottom a set of contextual factors, and this is what I'm calling observed contextual factors. These kinds of things: the teacher and student characteristics, the curriculum, the school leadership, the policy environment. And often in these kinds of models, you will see them in a box at the bottom, like this. So then I started thinking about these, and what does this sort of model kind of assume about those factors? Well, first of all, the sort of model, generally speaking, there's an assumption that they're relatively stable, but actually they're not. They're dynamic. So school leadership, for example, changes over time, clearly, and that will affect potentially a program depending on how long term the program is. And not only that, school leadership practices and attitudes may well change as a result of the program. If they see it working, they might have their perspective on the program may change, and equally if they don't think it's working as well. So that's the first of these underlying features that I picked out. The second one is that, and I'm going to stick with the school leadership example, that this isn't a kind of passive thing. School leaders are doing lots of other stuff at the same time. A typical example of a CPD program might be one that's trying to improve student learning in relation to reading. There'll be lots of stuff going on in the school that the leaders will be undertaking and teachers will be undertaking, which will be aimed towards the same kinds of ends. And so we need to think about that as being important as well in relation to the context. I also use this term relational as the third feature. And I mean by that first of all, these kinds of things can affect programs at different points, I guess, in the program. So a good example would be just engagement to begin with, and there will be certain things which will affect whether in this case pupils and teachers will be prepared to be engaged in a program, and those might be well different from the kinds of factors that affect whether the instructional practices are likely to be more effective in improving student learning. Not only that, these kinds of these sets of factors, and I think this probably starts bringing us a little bit more into the realist area. They don't operate independently; they operate together in relation to one another. So school leadership will be related to curriculum, will be related to how teachers behave, and so on. The fourth of the factors that I sort of picked out is that generally we think about an evaluation as evaluators within the time frame of the evaluation, but obviously it's historically located too. And the example that I gave in the paper there was that thinking about how teachers respond to a programme, there's some evidence from the education field that can shift depending on their what is sometimes called the professional life stage. So the kinds of CPD that tend to be effective for early career teachers aren't necessarily the same ones that are more effective for more experienced teachers, and their responses to different types of CPD may differ as well. So understanding the kind of historical context can be important as well. The fifth one that I've picked out is that, and this again is getting us right in thinking into the realist area. I've used this term imminent, and this is maybe actually where I started with this, which was that I had this concern about this box of factors at the bottom being external to the program, and that always felt like this is not analytically the best way of thinking about it, because how does a program work? It works by affecting hopefully by influencing the actions and the thoughts and the activities of individuals and groups of individuals. So it's inherent in, if the context has any influence at all, it's inherent in how people respond and how people act. It's not separate to or external to it. There's sometimes you see this billiard ball example being used. It's not the case that programs, I think people have used this term, programs don't sort of bang into people like billiard balls. Well, neither does the context. It operates through them. So these kinds of factors, often they are dynamic rather than static. They can be agentic or active and not passive. They're definitely going to be relational in the ways that I've described. They will be, some of them will be, and the program itself will be historically located, and the way they operate will be rather than external to, they will be inherent in or internal to or imminent in the program. And then I think finally, and some of this, depending on how you conceptualize it, you would say these are features of that, but it's complex. Often it's complex. That and by complex, I'm using that in the sense to mean some of those features of complexity in evaluation terms can be excuse me, inherent. So, for example, what I mean by that is there might be non-linear processes going on, which are hard for a model like this to deal with. Emergent changes that you wouldn't expect to see by change processes operating at multiple different, I'm going to use the term level. There's going to be uncertainty, there's going to be adaptation, and those things are quite hard to deal with from the perspective of this particular kind of model. So all of those, and that's difficult. That's difficult to take into account, I think, but it's important. So those are my 1, 2, 3, 4, 5, 6 underlying features. In the paper, I also mentioned, of course, there's others as well. We always treat the program as being temporally located in probably just before and just after and current to when the evaluation is taking place, and it's located geographically often as well. But those things I didn't include because they're just so well known. They're they're kind of not worth saying. I thought, but I just pointed them out. So getting towards the end, in the paper I've just drawn out here, I'm not going to talk through it in great detail, just one of the tables there, just to sort of bring them together and to think about, well, what would the implications might be from these kind of approaches. So, if we're thinking about context as dynamic, for example, we'll think about how the contextual factors work differently than if we think of them as being more static. and so on. So I'm not going to talk to this. I think we can share these presentations afterwards. There's the paper available as well. But I just thought I would lay that out there, and as I'm talking to it, you can sort of have a look there, and hopefully they'll help you. You know, it's just really summarising what I've just said. And then I'm going to conclude now. And this I've just pulled a bit out of the paper. So what am I claiming? Well, I think I'm claiming that if we do think about these features, and as we're thinking about context in evaluation, and this isn't specific to realist evaluators, I think it's all of us, whatever kind of evaluation designs we're using, hopefully it can help us gain better insight into the way the initiative is working and the way the context operates in relation to it. And hopefully that then can enable us to be able to enable us to have stronger transferable learning, and not and possibly help us move away from my kind of concern that I started with around, you know, we know this set of this box of factors is likely to be important here, but where does that lead us next? When I think there is then the need to move on, you know, in terms of contextual theory, and that's the point at which I'm really excited by the next presentations. I think that Anna and Joanne and Rod will be taking it on much further than I was able to do. And that's it from me, Gillian.
Well, thank you very much, Mike. Gosh, and that's as far as you've taken it. You've already given us quite a lot to talk about. So thank you for that. What a barnstorming start. So our second presentation is actually comes from the authors who wrote their paper, and it's the paper that triggered the preparations for this webinar. So let me introduce our speakers. Professor Greenhouse is Professor of Applied Social Research Methodology and interested in applying realist evaluation and synthesis to understanding healthcare policy and practice. Professor Greenhouse has carried out several National Institute for Health Research funded realist projects. Current work includes a realist synthesis of how partnering interventions support quality improvement in healthcare, and a second, Qual-Dash, which aims to design and evaluate an interactive dashboard to support the use of national clinical audit data to improve care quality. She is also involved in a 3-year project funded by the Nuffield Foundation to review the evidence underpinning youth justice interventions. All of these in collaborations with other academics. Another strand of research has focused on the design and evaluation of patient-reported outcome measures and their application and use within routine clinical practice. Professor Greenhouse is president of the International Society for Quality of Life Research. And her colleague, Dr. Manzano, is Associate Professor in the School of Sociology and Social Policy at the University of Leeds, an applied social scientist working mostly with healthcare disciplines, bringing methodological expertise in the research and evaluation of complex public policy issues. Dr. Manzano is interested in the relationship between research methods, evidence, and policymaking, particularly where health and social realms meet. Dr. Manzano has worked in hospitals for a decade and admits to loving everything about them. The smell, and perhaps surprisingly, for those of us who spent time eating it, hospital food, the people who work there every day, and especially those who use hospital services. Applying a range of social research methods to evaluate applied healthcare interventions, Dr. Manzano collaborates with health professionals, social scientists, and health service researchers to develop evaluations of complex interventions using qualitative and mixed methods approaches. Both Professor Greenhouse and Dr. Manzano were members of the Ramesses II group, which developed methodological standards for realist evaluation. So we know we're in great and safe hands. And ladies, I welcome you. Good morning to you both. Please take us into your presentation.
Good morning, Julian. I'm going to be, thank you so much for those introductions, and so thank you for inviting us, and to Kate for coming out with this idea. I'm going to start and then Joanne will follow. We're going to present the findings of this paper that you mentioned that was published last year. That is called Understanding Context in Realist Evaluation and Synthesis. So the background of that paper is that when we were doing the Ramesses II quality and reporting standards for evaluation, we started thinking about context a lot, and we did prepare some training materials. We had to write 1,000 words on context, and Joanne and I were leading on those 1,000 words, and we had some fascinating conversations, and we kept thinking, actually, you know, there is really more written in the realism scholarship about mechanisms, but not that much about context, so it's unnecessary. You know, we need to delve into that. There were some exceptions, and I put some examples in here. More things are coming up, like Rod's paper, but those days we really draw a lot in Mike's paper as well. So when we were doing this paper, we didn't really want to come across as being what we call the realist police. You know, police how people have interpreted context or how using it. We also didn't want to define it, probably because we knew how hard it is, or quantify the different ways in which realist scholars have defined it. We just wanted to use the paper really to help us thinking through context as an analytical tool, how we can use it, and hopefully other people, you know, could learn from that as well. So on context, the first thing we encountered is what we kind of knew. There are numerous definitions of context in the social science and evaluation literature. And this quote from Bouton was really helpful. It's this idea that it's almost impossible to talk about context in general terms. Context is always defined specifically. So the question is whether what is context had actually no general answer, but answers specifically adapted to the challenging macroscopic puzzles the sociologists want to disentangle. And that was really useful for us. But then we thought, okay, so, well, depending on the philosophy of science that sociology is using in their daily work, those puzzles will look different. So as realists, we understand context as the route to middle range causal explanations. This idea that there are semi-predictable patterns between, you know, mechanism and context that will create specific outcomes, and those patterns are generalizable. So we decided on 3 main questions that we wanted to interrogate the realist literature, and realist we meant on empirical studies that had used either realist evaluation or realist synthesis. And those were how do current realist evaluations and synthesis conceptualize context? How is context mobilized as an analytical tool in producing those causal explanations? And then what implications does this have for implementation? So we just did a scoping review of the use of context. And we look at papers published in 2018 because the Ramsey's guidance have been published, year before. We searched for papers that claim to be, so they had to be specific and say we've used the kind of realist evaluation, as we call it, a la Paulson and Tilly, and synthesis. And we looked at a variety of type of papers, reviews, evaluations, but also protocols. And they had to have context in the title. And after we screened all those titles and abstract, we purposely sampled 40 of those papers. We read each paper in full, both of us. We extracted data on aims and objectives, design, how context was defined, how context was then articulated in the findings, and tabulated all this. The typology of the ways context was articulated and mobilized as an analytical tool to produce causative explanations in those findings was produced. And then we also examine underlying assumptions implied by these conceptualizations. What was the story, the narrative of context that each empirical study was producing? And then we compare across papers to identify commonalities in which context was conceptualized first and then also used. You got the paper in there that was published in International Journal of Social Research Methodology. And we basically established these two main and very broad narratives of context. The first one is about context as a thing, and that thing triggers. Or the second narrative that was about context as relational and dynamic features that interact with mechanisms that may sound a little bit more like the kind of context that Mike was talking about in the first presentation. I'm going now to pass the microphone to Joanne. And I'll keep doing the slides for you, Joanne.
Thank you, Anna. Appreciate it. Yeah, so just to carry on from what Anna explained in terms of how we did our scoping review, and just to give a little bit more information about the two narratives that we explored or we identified, and I'll express some caveats around that towards the end of the presentation. And I suppose just to explain a bit more, sort of the idea of context as a thing that triggered. This sort of narrative saw context as something that kind of triggered or enabled or supported or facilitated an intervention, or sometimes blocked or acted, as a barrier to intervention. And I have to say that we really like your paper, Mike. It really got us thinking about context, and it sort of seemed to very much sing on the same hymn sheet in some ways, and we drew a lot from it in trying to understand what we were reading in terms of the data we were looking at. And when we saw papers talking about triggered and enabled, they tended to represent what Mike calls the observable features, so context in terms of space, place, and things. And I think I really liked what you said in your presentation about this idea that interventions, and the same with context, are not billiard balls, and sometimes it did feel a little bit like when we frame context in terms of a space and a place, it can act that way. And again, it seemed to operate at one moment in time and sort of almost set in motion a chain reaction, rather like your sort of analogy of billiard balls, which is really interesting. It set off a chain reaction, and this chain reaction was either sort of conducive or not to the successful operation of the intervention. And again, it was framed as things that enhanced or hindered the effective operation of the intervention. Next slide, please, Anna. Thank you. And again, sort of this was echoed in some of the ways in which context was mobilized as a sort of causal explanation. For some papers, it was sort of portrayed as a neutral background that played little or no role in the explanation. So it was sort of just there in the background. Sometimes contextual features were sort of listed in general terms and divided into those which were seen as supportive and those which weren't. Sometimes it was sort of seen as a kind of fixed property of an individual place that operates in a direct or straightforward manner on outcomes, that again, very much drawing on the sort of characteristics that you talked about observable features, this idea that they're static, that they operate at a single point in time, that they trigger mechanisms, almost like a domino effect, that you press a switch and then that's it. And I was very struck by what you said, Mike, in terms of this idea that everybody knows that sort of leadership is a good thing, and we sort of read that in some of the papers too. So Anna, next slide, please. Alternatively, we also kind of explored a narrative or identified a narrative that saw context much more as relational and dynamic. And again, this seemed to sort of chime with what you talked about, Mike, as representing some of the underlying features of context. These features seem to be relational, dynamic, and context was something that, instead of triggering or sort of acting as a barrier or a facilitator, it shaped the way mechanisms, shaped the way that mechanisms works. And I think this is a kind of tricky, in some ways, analogy to get across. And I think it's almost like, in some ways, I was thinking about it this morning, as you do, how am I going to explain this? And I sort of think, well, if you imagine a sort of plane going through some turbulence, the turbulence is all around the plane, it's buffeting the plane, it's sending it in all these different directions. And in some way, that's how sort of this context, it's emergent, it's the interaction between the context and mechanisms that's really important in explaining how the interventions worked. And there are some example there. We don't have time, I won't read them, but you can do it at a later date because we're going to share these. Next slide, please, Anna. I feel like it's awful. Thank you. And just to say that this also figured in the sort of explanations, you know, when papers were reporting their findings, you know, they looked at configurations that incorporated causal explanation, which context was described as a force. So, you know, in the same way that turbulence operates as a force, when you think of a plane going through it. And I think what these sort of explanations emphasize is the relationship between the context and the mechanism and the outcome. You know, that context just didn't happen and then the focus was on the mechanism and the outcome. It was how the context interacted with the mechanism to produce outcomes. So I also think what was important here was that studies attempted to explain what it was about the context that shaped the mechanism. So this was much more about what context does rather than what it is. So in some ways, describing the observable features tries to delineate what context is, whereas trying to explain how context shapes the mechanisms focuses much more on thinking about, well, what is it that context does? And I think that was really important. So next slide, please, Anna. So this, you know, and I remember us having this reflection when we were writing the 1,000 words explanation on context, which was funded by NIHR, and of course, you know, we're very grateful for their funding, but obviously what we say doesn't necessarily reflect their views. And you know, we obviously read Maxwell's book on realist qualitative methods, and you know, I've always really liked this quote that he said, you know, that realists are not just arguing that causal relationships differ across context. Absolutely they do. But they're making a more fundamental claim that the context within which a causal process occurs is, to a greater or lesser extent, intrinsically involved in that process. So in other words, context is enmeshed with the mechanism. It's not something you just think about separately as a, I don't know, as a facilitator or barrier. It's what is it about that context and how does it interact to produce that mechanism? So in other words, what realists are arguing is that context is inextricably enmeshed with the mechanisms through which a program works. This means that we need to think about context in relation to particular mechanisms and as a constituent and interconnected element of a context mechanism outcome configuration, not as a separate entity. So again, it's that sort of importance of thinking about CMOs as a kind of interaction, not as separate entities, and sort of lining them up. Next slide, please, Anna. And also this struck me that, or struck us, that it has implications for, I have to say this was the most fun paper we've ever written because we got to go to coffee shops before the pandemic, didn't we, Anna? It was great, but it took a long time because the pandemic hit. But what struck us over those coffee shop conversations was that this, in a way, the thinking of context in different ways has different implications for implementation and for evaluation in terms of what we're trying to do when we've evaluated a program. So if we think about context as a thing that triggers, it seems to me that the underlying assumption seem to us that the task of evaluation is to identify almost like the optimal contextual conditions that will maximize the effectiveness of an intervention. Therefore, if we're going to implement that program in other places, what we're then trying to do is almost like reproduce those contextual conditions. And to some ways that gets us full circle back to the thing that we were trying to avoid, this idea that we can easily identify these optimal contextual conditions that's going to maximize the effectiveness of an intervention. Whereas if we see context as something that's relational and dynamic, that interacts with mechanisms, the task of evaluation is more about explanation in terms of understanding how and why context shapes the mechanisms through which an intervention works. And therefore, the goal of implementation is about targeting or adapting the intervention to fit with different contextual conditions. It's not about trying to isolate these ideal contextual conditions and replicate them. It's about trying to say, okay, well, what's the context like here? How might we have to adapt the intervention to fit in with that context? Or how indeed might the context, lead to the to the adaptation of the intervention in order for it to work in that setting? And final slide, I think. Thanks, Anna. So obviously, you know, there are some caveats and limitations about our analysis. You know, we recognise that the studies we analysed were not necessarily representative of the whole range of realist evaluations. We had a limited amount of time. We chose, you know, a particular year because of its location next to the Ramesses guidelines. But, you know, had we looked at another year, it may have been that we found something else. Of course, you know, we can be criticised for arguing that our analysis is subjective. It's perfectly possible that perhaps someone else who read those papers might have come up with something else. But, you know, I hope it wouldn't be too different, and they would have recognised that someone else who's read those papers would have recognised the things that we talked about. We also didn't use any assessment or filters of the study quality of the studies. You know, we didn't do that. We were just interested in understanding the studies. Interestingly, 55% of the studies that we did look at did mention the Ramesses standards. And again, our aim was not to, you know, name and shame. It was about provoking thinking and about helping everybody and thinking through for all of us, what is it that we mean by context? So thanks very much. That's the end of our presentation.
Well, thank you very much indeed. Gosh, you've certainly added a tremendous amount to on top of Mike's structural definitions of context, and thank you very much for that. We now turn to Professor Rod Schieff. Professor Schieff is at the is Professor of Health Studies, Health Services and Research at the Peninsula Medical School, the Faculty of Health at the University of Plymouth. His research interests focus on the overarching question: what are the relationships between organizational structures, production processes, and policy outcomes in health, public, and third sector organizations? Professor Schieff has conducted research on these topics in the UK and a number of other countries, including Germany, Italy, Sweden, Russia, the USA. And current and recent projects include evaluation of 4 programs for preventing hospital admissions of frail elderly people under the National Innovation Forum for Cornwall County Council, and evaluation of redesigned services for vulnerable older people, the Evercare project, for Department of Health in England. Professor Schieff has authored and co-authored several books on health services and health service management, some of which may be busily being reread by NHS managers as we speak. Professor Schieff, you're most welcome. Please take us into your presentation.
Okay, well, good morning and thank you. Let me just try and get my screen shared with you so you can see the slides.
We can see your slide.
Right, okay, here we go. Well, I plan to do 2 things this morning. One was to start by giving a bit more background and elaboration of the set of categories that we produced in a very empirical way during a study of the implementation of the NHS patient safety collaboratives. That work began about 5 or 6 years ago. So we did that work, we published the paper, and no sooner had it appeared than Joanne and Anna's paper also turned up in the press. And that gave me cause to think both about the categories and about the nature of context in realist evaluation more generally. So from that point of view, it was a very good and useful and stimulating paper. Anyway, I'll begin with the empirical study, which is of patient safety collaboratives. And to do that, I just need to give a very brief background about what the NHS patient safety collaboratives were. Now, some among us will remember that in the early years of this century, there was a series of scandals at the Mid Staffordshire General Hospital because a number of patients had died avoidably, and many others had suffered poor quality, even negligent nursing care, whilst meantime the attention of the hospital managers seemed to be focused on completely different things. There was a public inquiry which came out in all with 503 recommendations for things that might be done, but fairly prominent among those recommendations was to set up patient safety collaboratives. Now, since we're mainly realists here, I'll speak in realist dialect and say that the patient safety collaboratives consist of two sets of mechanisms. One set of mechanisms, it operates at the clinical team area. So this is the area of the emergency department, the general practice, the hospital ward, whatever it might be. And the idea here, the active ingredient here is that one tries to maintain and improve the quality of care through what are called, well, through a process which has many names, perhaps most often used as the plan, do, study, act cycle. But the basic idea is that you get the health workers and the clinicians who are providing the service to take measurements, take observations, collect other data they can to review how well or how badly their service is going, what the areas for improvement might be. Second stage is that they then devise ways of improving the service they provide, which they do by looking both at good practice elsewhere and at the current evidence base. A third step is they implement those changes, and the fourth one is that they then do more observations and measurements to see how it all works out in practice. And as you'll guess, the cycle then repeats itself indefinitely. So that's the team level set of mechanisms. The other set of mechanisms is really the kernel of the collaborative itself. And the purpose of those mechanisms is both to implement the first set of mechanisms as widely as possible, and as that happens, to enable the clinical teams who are doing that to network with each other so they can share information, data, knowledge of problems, knowledge of possible solutions, and so generally reinforce and perpetuate the whole process. If you look at the policy documents that the UK government produced just after the Mid-Stafford public inquiry, they do, although they don't use realist language, they do lay out pretty clearly and pretty explicitly a set of mechanisms by which this will be achieved. And more unusually for policy documents, they also set out some context which they stipulate ought to be in place for the thing to work. So this is the set of context mechanism outcome configurations that one can find in the policy documents, ministerial speeches and so on at the time. And as you can see, it's a concatenated set of mechanisms. The policymaker's idea was that each of these arrows represents a mechanism, and each one mechanism then starts off another mechanism or set of mechanisms, leading eventually to increased quality and safety. I don't know if the cursor is visible, but I'm just hovering it now on the first box up from the bottom, and the arrow leading into it from change provider safety culture and climate. And this mechanism here is the one which within which you have that plan, do, study, act set of mechanisms as a component. So that arrow can be unpacked into that subset of mechanisms. So the purpose of the evaluation, therefore, was to see how far NHS organisations had implemented these mechanisms or something recognisably similar, whether policymakers had got the context right in their assumptions, and finally, to try and find out if we could, whether there had been any outcomes to report in terms of improved patient safety and quality. But that's another story. That's another session if you feel like organising one, Julian. Anyway, so that's what we that's what we were charged to do. Oh, and I should mention at this point, because it was funded by the Department of Health, what you're about to hear is not the view of the Department of Health, nor of NICE, nor of the NHS, nor of Her Majesty's government, nor of Her Majesty, just the researchers. So what do we find? Well, two things will be obvious to you if you have a good visual memory, and one isn't obvious. The first obvious thing is that the configuration of mechanisms that we actually found in the field, through the fieldwork, was pretty similar to what the policymakers had intended and what they had expected would happen. What's different is the number and complexity of contexts that were at work in influencing the way that these mechanisms worked. And the one thing you can't see from this picture is that this is already a great simplification. I mean, our original attempt to draw this map resulted in something that looked like the the internal wiring diagram of a microchip. Many more links and variables than we've shown here. We've cut these down to what we judge to be the most influential contexts. Okay, so a couple of points about context. In hindsight, they're pretty obvious, but they leapt out when you map them like this. One is that you can have one. You have a single mechanism can have many different contexts working and interacting upon it at once. So if you look at the chart, mechanisms 4 and 8 each have 5 contexts bearing upon them. Conversely, you can have one context that simultaneously affects a number of different mechanisms. So if you look up here, the consequence, the experience or the memory of past policy initiatives in this area, that impacted upon at least 4 mechanisms within this complex. One thing we left out, but also became evident, was that the contexts interact among themselves. For example, if I'll just try and go back, there we are. One thing that policymakers thought would be an important context was contractual incentives. So the idea is that you get providers to do their quality and safety work partly by paying them extra, making them a contractual payment of some kind or a reward payment. What we found was that the effect of that actually is itself altered by the size of the organisation. Well, I've got organisation size in here somewhere as a context. And the reason that is, and one way to explain that is to look at the difference between hospitals and general practices. If a hospital gets an incentive payment, then the chances are that in practice it's going to be paid to the hospital finance department, and it'll just disappear into the vast swamp of hospital income and payments, and that may be the last that anyone sees of it. If, in contrast, you look at a general practice, there you have a clinical team, which also includes the GPs themselves, who usually are co-owners of the practice. So they directly are exposed to the monetary incentives and can directly transmit them into the clinical team. So there you have one context, supposed context, contractual incentives being moderated by another context. So I've put it to you all that there's a paper or two waiting to be written here about those sorts of complicated relationships. Okay, now we come to Joanne and Anna's paper, which, as you've seen, reports the idea that some people think that contexts include the triggers of the mechanisms which make up a policy initiative. Now, I've deliberately chosen my words carefully here. I said that Joanne and Anna report it. I'm not saying that this is their view. I mean, they're here and they can speak for themselves on that point. But that certainly got me thinking. So in what ways might a trigger of a mechanism be similar to a context, or in what way might it be different? Well, it struck me that there are 2 important similarities. One is that, like context, the triggers of a mechanism work through causal relationships, degenerative structures, as realists call them, which can be either social, commonly are social, of course, in the kind of policy context we're interested in, but they can also be physical triggers. If you think of military campaigns or something like that, the triggers can also be very, very, very physical. The second resemblance to context is that a trigger, like a context, has a big impact on what outcomes appear and whether outcomes appear. Indeed, an even bigger effect than contexts do, because although the contexts adjust and alter and deflect the outcomes that a policy mechanism might produce, without the trigger, you don't get any outcome at all. So the question of context doesn't even get started. So those are differences. 3 main similarities. 3 main ways in which contexts are unlike mechanisms are unlike contexts. Firstly is that, I mean, to my mind, the mechanism seems intrinsically embedded, the trigger seems intrinsically embedded into a mechanism. As I said just now, without a trigger, no mechanism, no outcome. So, but contexts, in usual understanding of the word, don't actually start a mechanism going, they adjust and deflect it. So if you want a really grossly crude analogy, a mechanism is like the on-off switch, the context is like the dimmer switch. They're slightly different kinds of effects. The second point is that the second difference is that mechanisms are where a mechanism is pretty similar across different settings, then so is the trigger. So the trigger is adapted to the mechanism and it's inherently linked with it. Whereas the beauty of realist evaluation is that it recognises that the range of possible contexts is much wider, much more varied than that. Finally, the point I'll come back to is that policymakers and implementers they control, they operate the triggers, whereas that's not necessarily the case with all contexts. So, for example, if you consider the size of a hospital as something which affects as a context which affects how patient quality initiatives work. I mean, one way it does that, I mean, I mentioned one already, but another way in which size matters in this context is in the relationship between the size of a clinic or a general practice and the workload it has to face. So the size of the unit obviously determines its capacity to handle patients, but the number of patients it has to handle is, for practical purposes, pretty much given. And even policymakers can't do very much to alter the age profile of the population, its epidemiological characteristics, and so on. They can only respond to that as best they can. And yet, it's a critically important physical factor, physical context, affecting whether it's feasible to introduce these quality and safety initiatives and what effect they may have. Okay, so there you are. There's the classic realist model of a context. So take the example of general practice again. In many countries, Britain, Germany, the States, and so on, the public health authorities don't own general practices. The general practices are subcontractors to the public authorities, and the public authorities typically try and influence them through contractual arrangements and incentive payments. So here we have a commissioner trying to make an incentive payment to a subcontractor, but of course it gets taxed. So the tax system, is a classic moderator. It takes some of the financial incentive out of the system. It weakens the effect of the incentive payment. By the way, you could also imagine a moderator that had the opposite effect. So let's say the Royal College of GPs or Bill Gates or someone took it into their head that they would match fund the official NHS incentive payments. In that case, you'd have a moderator which potentiated the incentive payments rather than reduced it. Okay, so far so familiar. Next thing, as we saw in the patient safety collaboratives, mechanisms are often concatenated. One leads to another, leads to another, leads to another. So in this model, you have a position that you find in a number of countries, parts of Britain, although it's not common, more commonly in the States and Australia, and in a different way in Germany, that the commissioners don't actually deal direct with the general practices, but rather that the commissioners pay some sort of organisation, a network or a coordinating body or an insurer, someone like that, and they pay the general practice or the equivalent. So the commissioner tries to use its payments to influence how the lead contractor then uses its influence to change the way in which the general practice changes. So you've got a concatenated three-step process, two mechanisms built in there. So I think in view of what I already said about the differences between and similarities between context and triggers, that neither of those things is a trigger, but the trigger is actually something else. It's the first stage of the mechanism. So I'm disagreeing with some of the papers that Jonah and Anna reported. Finally, just to go back to where we started, what categories of context do we find? Well, there they all are. You can read the details in the paper if it's of any interest to you. Only a couple of words need explaining it. Outcome headroom. One thing which is important for the safety of an operating theatre is that you don't get post-surgical infections in your patients. Now, if you've got an operating theatre who's already pretty good at that and doesn't do that, then immediately there's very little point in making an intervention here. In the best case, you'll get the same outcome as you had before, and in the worst case, if you mess around with a PDSA cycle, you'll only make things worse. So, health workers in these contexts tell us, to my mind, with good reason, that sometimes if there's no improvement headroom, you should just leave it alone, don't intervene. So that's why that acts as a context. The other thing is convergence. That's just our local word for what earlier implementation researchers such as Rod Schieff and others called policy mess, where you have one set of policies interferes or obstructs the working of another. So you can have policy and safety initiatives. You can have a policy that hospitals treat all patients that come into the ED, emergency department, within a certain space of time. And you can have tight fiscal control of hospital spending, but not altogether. Choose any two out of the three, because the policies interact. One serves as a context for the other. Well, there we are. I think the last thing to say is that this is our empirical list. I trust there are lots of current and budding realist evaluators in the audience. I'm sure that in years to come, you'll find ways to improve on and extend this list, or at least I hope you do. Thanks for bearing with this.
Oh, thank you very much.
That's right, there's acknowledgement again, but I did that earlier.
Thank you very much, Rod. It's great, and thank you very much for adding some additional contributors to the work that we premiered with Mike's work. It's interesting how these things come together. I'd like to ask all four of you to join us on camera if you would. That would be great. We've got some questions that come in, and we also have some questions that we had sent in earlier. But I'd quite like to start with one of the questions that came in. That's been, I know it's been pointed to you specifically, Joe, Anna, but I think that maybe we can have a wider discussion about it. And it comes from Andrew regarding the recognition that introducing something new into a context changes the context, and therefore something that works in one context and should work in another doesn't work in the latter context. Did you see this in the literature that you were reviewing, or do you have experiences from your research work that you'd like to reflect on in response to the question?
I can't recall individually of all the studies that we read whether that was something that they reflected on. I'd have to go back and reread them in detail, but I certainly think that that's an important issue. In some of the projects I've worked on, I've certainly seen that when an intervention is introduced, it changes the context, and then this context then means that the intervention has to adapt accordingly. So one example I can think of, and I think we use it in the paper, is a project I worked on when Ray and I were doing the demand management realist synthesis a long time ago now, but we worked with Martin Rowland and his team. They were doing updating their own review, but they were also doing some empirical work on referral management centres, which are not in any policy documents, but something that was invented by clinical commissioning groups to review referrals to see whether they really needed to go to secondary care or whether they could be diverted elsewhere. And what, in their interviews, what emerged was that the referral management centres often started off just collecting data on referrals, and then they introduced a kind of new services to reflect what those referrals were needing. But then they in turn When they got more referrals, they found that they then had to triage those referrals to decide where they went. So something new was added to the referral management centre. So I definitely think that context, you know, there's a definite, as Mike mentioned, there's a feedback effect, definitely. So yes.
Okay, thank you very much. Any other comments the other members of the panel would like to make, or Katie, would you like to make a comment about on the question about introducing something new into context before we move on to another question?
I think it builds on the question, actually, Julian. Really, it's been fascinating. Thank you so much for the professors, and they've introduced a range and variety of context, you know, particularly this issue where we're talking about context in the way that it might shape and influence change or interact with mechanisms. I guess it's a really, to move that into the pragmatic application of that. So, you know, clearly this can be really overwhelming for researchers, really overwhelming for PhD students. I know we've got a number of those on the call as well today. And also when we're working in practice, it can be frustrating for commissioners who, as we know, do like to have a simple answer. So there's some pragmatic questions coming in around how do we manage that complexity? Is there any sort of practical advice for how we recognise that complexity, we pay tribute to it, and we illuminate it, but we also make it possible for people to actually do this in a way that doesn't sort of make their head explode? So it's really sort of trying to just get some advice from you all as to any practical measures we could take to help manage that complexity.
Managing complexity. Okay, there we go. So it's a big ask. Ana, do you have something you'd like to add to this on this?
Yeah, I will start by saying that I think it's different between kind of commissioners and you know, practitioners or implementers, because I think when I've worked with them, they are very aware of the complexity. So, and in fact, it is very frustrating by implementation teams to see how difficult this thing is. And when you tell them, yes, it's difficult because of that and that and that, in a way, there's sense of a relief. That is not them. It's not that they've done something wrong. It's not that they didn't push people or that they didn't bring more resources. It's that, you know, this thing is all those things that Mike wrote, you know, relational dynamic agent, and it is going to happen. So I think we need to take away that fear that by saying actually things are not black or white, good or bad, that, you know, it depends, that's going to create like a bad reaction, because my experience is that's a good reaction. And actually that's mostly experienced commissioners and also experienced practitioners, what they've seen themselves. And to see this as accumulating knowledge that is, you know, slowly but surely will get us to better circumstances instead of just this magic bullet that, you know, I'll give you this magic solution. So, you know, things will get better immediately. It's a very slow process of accumulating knowledge. That'll be my view. Okay. But the others can expand.
Yeah, slow process of accumulating knowledge. Well, that's certainly the case. And I maybe I could bring you in here, Mike. How do you think about this level of complexity we get when you're thinking specifically in the world of education? And because, you know, things that seem to be specific are often quite broad, and you've brought your own impressions of context to us today, but I can see wide application. So your thoughts on this would be very valuable. And then Rod, I'd like to come to you in the healthcare arena too, please.
Okay, I'm not quite sure how I'm going to answer that. I suppose. Well, what I was going to say, I'll start with what I was going to say, which is one of the things that I really took that I think is important from that Joe and Ana emphasised is, and it was one of the slides that Joe presented, where you talked about it's not so important what context is, it's what it does, and that is, and I guess that would be my starting point, is, you know, which are to try and make sense of the the context is, what are the things that actually are doing things, the most important things that are doing things that are influencing or interacting with the mechanisms in the way that Joe and Anna talked about before. So that maybe would be one way of helping. I suppose the education context, I don't know. One of the things that I was reflecting on why I always get so hung up on senior leader support and cultures, and I think that's because, and again, this probably isn't answering your question either, Julian, but this is the education specific thing, is the importance of the organisation in the education field, particularly in England and in the UK. The school as an organisational entity is really, really important in comparison with other systems, for example. And the school's always important, but because we have we've kind of really dismantled the mid-tier, if you like, between schools and central government with the creation of academy trust. So the role of the senior leaders and the role of the school is so central. And I think that's why I'm constantly coming back to this. This is such an important area, and I suppose that is something which I did have this little bit in the paper that will be also relevant to other public sector contexts that will be different maybe from from others. So I think probably there'll be some comparisons there with health settings, but also they'll operate in slightly different ways as well. And I suppose that's one of the valuable things about comparing across these public policy areas, is it enables you, by making those by making those comparisons, you start to see things about your own, the milieu that you work within that you wouldn't necessarily see otherwise.
Great, thanks, Mike. And coming to you, Rod, I think you kind of touched on this when you were saying that the apparent triggers for some of the changes that you were looking for, or you observed in your own work, weren't what were necessarily being considered by commissioners up front. So there's a lot of complexity here, and some of that complexity is actually understanding what the context is, as well as understanding how the context actually has its impact on the intervention, and creating that trigger point. Did you want to say a few more words about it before we move to our next question?
Yes, sure, I did. I mean, the complexity and interaction of contexts among themselves certainly bears repeating, and that alone is a point which maybe might generalise to other sectors, other kinds of services. I mean, it seems to me there are at least two ways you can think of the analysis of context. You could say, well, it's very complex, it's very particular, it's unique to each particular policy implementation and setting, and for sort of academic and research purposes, that's all right. That's a that's a respectable conclusion and a little bit of an addition to knowledge. But I'd have thought for implementers and managers, it is the generalizable patterns of context which might be of greater interest and practical use. But I think the trick here is to be intelligent in the way that one specifies it. For example, I talked about organizational size, and put like that, it sounds like the very sort of thingish description of context that Joanne and Anna sort of warn about in their paper. But the important thing here is to understand, well, what is it about the size of an organization that matters? And in our study, it's the organization's capacity to handle workload. That's why size mattered in that context. So formulated that way, that may apply to, let's say, schools in areas where they've got far more demand than they can handle.
Great, thank you very much. One of the things that's come up is thinking about the advice that you might give for PhD students in particular. So one of the later questions that's just popped in about how to deal with some of this work. About how to deal with context in their own write-ups. What kind of general advice might you be able to provide to those who are struggling with context? And I think I would have to put my hand up and say, well, I'm struggling with it too. So I guess in some ways we're all struggling with it. Is there some advice, tips you can give to our colleagues who are trying to write up right now, Anna?
Yes, I'll go in first. Well, first is to understand context as complex. You know, like we tend to use more mechanisms that are complex. And the set, well, kind of a trick that I use with the teams that I advise when they're trying to look at their explanations, there is this tendency to that. Actually, when I did my PhD, we didn't use to phrase them as much as this, to use the prepositions of if this happens, then that. No, if leadership is supportive, then trust will happen, and then people. And I always say, add why. So why is that? If leadership is supportive, that, you know, change because, not why, add because leadership is doing that and that. And that's the why bit that we miss a lot. So trying to add some becauses in those explanations at the beginning, they're more difficult to find out because you're really, you know, exploring those. But when you get in at the end, at the beginning, they can be tentative. But, you know, see if you can have enough evidence in there, in your data or in the literature that can help you understand those. Because, and you can see in the examples in our paper at the end that people were treating context as relational. You could see those because in their explanations. And I think that's a little trick that I think in my studies has helped people.
Great, thank you.
Yes. Can I just jump in there? I think in terms of the sort of practical advice for PhD students and other researchers is that, as you can see even from these three presentations, that dealing with context is complex, and also how we describe context is variable at the moment. And so what my kind of key advice would be is define your own terms. You know, pick up a piece of work that makes sense for the context in which you're working in. Again, sorry, use of the word context. And make sure you define your terms, because as an examiner or as a peer reviewer, what I want to be looking for is it clear what the person is actually referring to when they use some of these terms which have multiple meanings and various meanings. And so long as it's clear how you're using those terms, and particularly in a realist work, that you're really trying to pay attention to some of these underlying interactions, powers, liabilities, then that is sufficient at the moment. I would like to sort of ask our professors to comment on some of these questions that are coming in around, if context is so enmeshed with mechanisms, you know, do we need to define or distinguish between the two? And we've seen in the literature as well a real explosion of the CMO into various different iterations of that acronym. So just really wanting to just tease this out of your brains if we can, in terms of what could you say about that, the importance of distinguishing and or not, perhaps?
Perhaps yes, Joe, if you'd like to start, and perhaps we could go to Mike and then come back into Rod. Joe.
Yeah, I think that's a really good question. And so first, just to answer the question about PhD students, I feel your pain. I've had PhD students who've loved realist methods. I've also had one who said, I'm never, ever doing that again because it was so traumatic. But I think what I would say is, just to build on what Anna said, is think about what is it that context is doing? What is it that, you know, what is it about context that's important to the action of that mechanism? And I think this speaks to that issue around, you know, why distinguish them? And I think what we were doing in a way was, in the paper, we were responding to some of the criticisms that have been made to realist methods. In particular, you know, what's the point if it's all complicated? Why are we bothering distinguishing from a context, from a mechanism? And I think, you know, this is something that I really learned from Anna as well, and this is something where, when we've been doing our training, is that the idea that context and mechanisms don't sit in cages. Anna, I really like, I don't know if you want to speak to that, but it's this idea that it really does depend on what you're trying to explain, and sometimes the same phenomena you can think about it in your explanation as occurring or operating in a mechanistic way. Sometimes it might be in a contextual way. Anna, I don't know if you want to speak to put you on the spot, but there's definitely something I learned from you.
Yeah, no, that's the thing. I think it's thank you for the person who brought in this question, because it's been mentioned a couple of times to us since we wrote the paper. I think it is important to try and distinguish them, but not to agonize over it, and also not to think that this is a static distinction. Because in the next configuration, that thing that you call context may well be a mechanism or an outcome, and this is the problem. So just be mindful of why you want that distinction. And sometimes, when you're at the end, when you're presenting your findings, I always think it's a good idea to remove those labels. Forget about that. It's not about context. It's not about mechanisms, or it's not about outcomes. It's about an explanation of causality. So therefore, that label shouldn't be repressive, it should just be abandoned and put it as part of the explanation. And then it really doesn't matter at that point what you called it. It matters how it works in that explanation.
Which I think is something that you touched on earlier, Mike. Would you like to make further comments about that?
Yeah, it's a great question. I mean, okay, well, what I was thinking, one of the things I've been thinking about is implementation science, which I think is quite interesting sort of field, and the sort of categorizations you get there, where they're really interested in sort of in what they call things like implementation features, and a lot of those, I think, actually these are context, these are context things, and they also in other fields you see more distinction between, like I wrote a paper about logic models recently, because they get used a lot in by what work centres, particularly what work centre in education, and sort of distinguishing in terms of causal processes between, I suppose you might call it the causal mechanisms, and then the implementation logic, and within that you've got some things that you might sometimes call context, and where am I going with that? I suppose it's just first of all, I'm just quite interested in that, and how within a realist frame you deal with that kind of stuff. What do you do with those, what you might call implementation features? Where do they sit? And I suppose the other thing that I'm really interested in, and these are asking questions really rather than anything else, is I wonder whether this is somewhere that Anna and Joan, you're moving, is should we be starting to look for a kind of I'm going to use the word categorization, but I'm not quite sure I mean that, but anyways, I'll stick with it, of ways in which kind of contextual arrangements can operate to influence or engage with mechanisms. So if it's about what they do we want to think about how they do it? I think that's partly what you were talking about there, Anna. This isn't doing the job of simplifying things, is it? But these are just things that are on my mind. So the first one was around implementation sort of features and how you deal with that stuff, and then the other one is maybe, is there a sort of theorization of how context can operate that is kind of the next obvious step?
Is there? Anna, Joe, would you like to comment on that? And I'll come to Rod, unless, Rod, you have an answer ready to give to us.
I'll let Rod respond, I think.
Okay.
Sorry for the dropouts, by the way. Well, one response to Mike's last remark is to say maybe, for a single theorization of context is a mug's game. That it may be that one thing that follows from having a set of categories of contexts is to say that there are different, that the ways in which contexts work are different for different kinds of contexts, and by implication different kinds of mechanism. So that would provide a much more theorized and possibly better way of categorizing context than we just did. The other thing to say about implementation sites is that simplification is all very well, but one thing which a lot of so-called implementation sites does is it seems to assimilate the implementation of a policy to the administration and the testing of a dose of some pharmaceutical product, which in my mind, I hope I don't offend anyone here by saying so, is very, very naive, because one of the characteristics of policy and indeed of management is that decisions and interventions are very often contested and disputed. So so in an organizational context, one important context very often is whether there are professional organizations or whistleblowers or disgruntled employees or someone else who simply want to stop it happening and want to obstruct it. And that's something which about which implementation science, well, to give it the benefit of the doubt, is usually tactfully silenced about. But it's an important context, I think.
Yeah, thank you. And Anna, you've got your microphone open. Would you like to add some more to?
Yeah, I was just on the comment on the implementation features, with implementation science, or even, you know, with randomized control trials. I think what we tried to do with this paper, and I think we said it at some point, we tried to move context from the background to the foreground, you know, to the front. And I think when you're still using that language, you're still considering context as this little thing that can be controlled, is an annoying thing. If we start seeing the context as analytical, almost instead of, I've got this idea, you know, you'll see that people saying, I've got this program, it really works in Sweden. Let's bring it to Bradford, or whatever, Barcelona, where I'm from. Oh gosh, these annoying implementation features that we need to think about it. So maybe it should be the other way around. Maybe we should not think about the program first, but think about the context and then say, you know, what can work in here. And this idea of bringing context to the front, I think is quite useful. It's always been either trying to control it or hidden. Maybe that's useful.
Yeah, I think that's an excellent point. And you know, as somebody who worked in health service for 40 odd years, I'm conscious that you can't just take one perceived solution from one hospital to another, let alone from one jurisdiction to another. It just doesn't work everywhere. Everywhere is completely different. And this is kind of summed up by Julia Rouse, who's noted that this is about understanding how context and mechanisms achieve their outcome rather than anything else, which I think are points that everybody's made during the webinar today. So I think you're absolutely right, Julie, and thank you for making that point. I'm looking through the rest of the questions that we've got. There was one that got sent in earlier that I thought we might try and address if we could. Let me just find it.
Julian, while you're finding that, I just wanted to just pick up on Julia's point, and there's a couple of other comments that actually recognise that potentially engaging with critical realist social theory can support with providing some of the theoretical architecture to help be able to place either context or mechanisms or combinations of the two. And I would subscribe to that view as well. I don't think we've got enough time to go into it in the last 8 minutes. But one other thing that I wanted to just remind people of, I think, is in Pawson's work in this 2013 Realist Manifesto, was to think about the idea of reusable conceptual platforms. And again, this is something which hasn't been that well worked through in the literature to date, as far as I'm aware, but starts to think about how do these combinations of context and mechanisms, you know, broadly brought together, support change, you know, in different circumstances. And I think that probably aligns with, although obviously there are differences in interpretation between Pawson's sort of view of critical realism and critical realism, but aligns with the view of the generative mechanism, something that can actually have emergent properties that affects change. So just wanted to highlight those couple of things, and it really is an invitation to the community to really attend to how we can actually start to accumulate knowledge through some of these different mechanisms in order to really start to illuminate those features a little bit more.
Thanks, Katie. Yes, thank you for your observations. I think it's really interesting to think about these things really in the round, and I guess we constantly do this, don't we? It's part of the realist community. We're constantly thinking about the approach that we take to bring these things together. And actually, one of the questions that came in earlier relates to the context compatibility that's come out of today's webinar. So in the last few minutes that we have, I wondered if our professors would like to just comment about what compatibility they see in their own determinations of context. I think we've seen some already, particularly between in all the presentations, and whether the context would benefit from further systemization to assist all those of us who are trying to get realist work done. I'm not quite sure where to start, so I might have to pick on somebody. I apologise for doing that. But Rod, would you like to start, please? Yes.
Well, can I start with your final question, which is a nice, easy one, and the answer is yes. Now, as for the previous question, I think there is quite a lot of convergence around the papers and the authors represented here today. I mean, we use different idioms, different sort of metaphors, but I think that we're pretty much talking about the same kind of interactions between context and their mechanisms. The need to see them as multiplex, dynamic, etc. I mean, I won't. There's no need to labour that point. However, some of the papers that Joanne and Anna's study report do see things differently, and there are unresolved debates. I mentioned the one about triggers because that caught my eye, but I'm sure there are others. And if we could just come back to the point about critical realism, sorry, because I was busy battling with the beast of Bodmin at that point, but it strikes me that actually critical realism might bring two things to the party. One is that it, depending on where the critical realist comes from, they might bring a different body of theoretical explanations and therefore different sensitivities to what counts as a context and how a context might work. So, for example, I don't know, a neoclassical microeconomist would see that would offer a different range of possible contexts than would, let's say, someone coming from a sort of psychoanalytic background. Less obviously, but equally important, I think the critical realist also brings a recognition that we don't have to evaluate the outcomes of policy in the policymaker's own terms. It might be all very well to say, does it save the public money? But there are other possible equally supportable aims of policy and policy interventions. And it makes perfect sense, I think, to conduct a realist evaluation which focuses also on those outcomes, the ones which the policymakers weren't interested in at the time.
Yes, yeah, okay, I can see that. Thank you very much, Rod. And maybe I could come to Anna, then to Mike, and then back to Joe. In thinking about the further systemization of context and how that might help the community. Anna, do you have thoughts on that before we go to Mike?
Yeah, I think further thinking on context is definitely necessary, and as I said, as part of this understanding the complexity better. The problem with systematization is you always are worried about doing this kind of authoritative account, like Katie was saying, there will be different understanding of context as there are different understandings of mechanism. So we've got Dawkins' understanding of mechanism as, reasoning and resources, but that's not the only one. The thing is, and as Jill Westop wrote in a chapter in Doing Realist Research and explain how mechanism can be conceptualized differently. So you're immediately going to encounter of this different understanding of context as we're seeing in here. So make it systematically, if it's not authoritarian or authoritative, maybe that's fine. It's understanding that there will be different understandings, and which one you pick one, usually explain one, and why is useful in the context of this study, and that's fine. Instead of thinking this is the truth, this is how context should be applied by every single researcher and PhD student. That's more, dodgy, I will say.
Great, thank you for that, Anna. Mike, and then if we could go to Joe, that'd be fantastic. Further comments?
I'll be really quick. I just really support that last point of Anna's. Really, I think the moving the field, whatever the field is, moving things on to think about context doesn't necessarily mean systematization, but it does mean thinking through thinking through context in multiple different ways. And I think Rod's point was really, really good before as well. You know, that actually within the field that you work within will also influence how you think about it as well. So I'm not sure about that that itself, but I think that it's really interesting, isn't it, that there's so much focus suddenly in the last year or two to turn to context. So obviously there's a sort of something going on in the field where people are feeling actually we do need to do more work on that. But yeah, whether systematization, I don't know. I'll leave it to others to sort of kind of work on that within your guidelines.
Okay, so we'll let Joe pick up the ball then.
No, I can only agree with what everyone has just said. I think absolutely it's really important. I think we do need more thinking about context, but thinking is the key here. I think if you systematize something, it runs the risk of taking the thinking out of it, and people just use it like a tick box. All sorts of reporting guidelines can be criticized for promoting that kind of tick box approach to saying, yes, I've done something, but actually you need to keep the creativity and the thinking in it. That's something that we can't hide away from. It is complex and we do need to think about it. So there you go, that's my answer.
Thank you very much. You're bringing us to our close. I want to just open the mic to Katie. Do you have any further comments or insights, Katie, before we draw our webinar to a close?
No, I'm just scheduling the next webinar in the chat at the moment. So just a great thanks for everybody. Thanks for everyone to come and for your attention and great questions. I think, Julian, is it right that we're going to be able to share a recording of the webinar? We're going to hopefully share the slides if the professors are okay with that, and probably a summary of the chat, because I think there's lots to go out there that we haven't had a chance to actually cover in the discussion today.
That's it. Thank you. Yes, you're entirely correct on all levels, Katie. Thank you very much. So let me bring our discussion to a close and thank our professorial panel for their insights and explorations of context and for the additional thoughts on related matters raised by our audience. Speaking of whom, I'd like to invite all of our remaining audience members to open their microphones so you can join with me in showing your appreciation of the professors in the time-honoured way. So thank you very much. Greatly appreciate it. Thank you. So as we bring into the last few minutes, I'd like to thank Katie for conceiving the webinar. Thank you very much. You brought us together. It's all your fault that we're here. And I'd also like to express my special thanks to Rachel Davison of the university's Advanced Wellbeing and Research Centre, who put together the Eventbrite booking process and created all the promotional materials that we've used today. Rachel, our heartfelt thanks for all of your efforts, and to Rachel's colleague, Carol, who has been instrumental in administering the webinar today. So thank you very much indeed, Carol. So with that said, thank you to our audience, to all of you for joining us, and from wherever you are in the world, please stay safe, stay well, and goodbye for now. Bye-bye, everybody. Thank you.